We've all been there, haven't we? That critical first impression in healthcare. You're new to a clinic, maybe feeling a bit anxious, and bang, you're faced with sharing, well, everything.
Yeah, the forms, the personal info.
Exactly. Filling out forms, giving all this information, trying to get that first appointment sorted. It can honestly feel like a bit of a mountain.
It really can. And, it's more than just paperwork. That first interaction, it's absolutely foundational.
Foundational how?
Well, it sets the stage for, data integrity, patient trust, even how smoothly the clinic runs later on. If you mess it up at the start.
You're chasing problems down the road.
Exactly. Chasing errors, dealing with frustrations. It impacts everything.
Okay, and that's precisely why our deep dive today is pulling back the curtain on this really vital first step. Specifically within a system a lot of practices use, eClinicalWorks, or ECW.
Right.
So our mission today is really to unpack how patient registration and setting up appointments actually works in ECW, how it's designed to streamline things.
For everyone involved, yeah. The patient and the front office staff who are often juggling so much.
Definitely.
And by digging into how it's set up, you'll start to see how it leads to, well, a much smoother patient intake. It cuts down on those administrative headaches we were just talking about.
Fewer headaches, that sounds good.
Right. And just a more reliable experience right from that very first contact, whether you're the patient walking in or the person helping them.
Okay, so let's jump right in. You call this workflow foundational, even a game changer. Why is this specific process in ECW, handling registration and appointments together, such a big deal? What's it really solving?
Well, what's really smart about it, I think, is that ECW isn't just, sticking a paper form online.
Right.
It's fundamentally built to combine two things that are obviously linked, but were often separate in older systems, getting the patient's info and scheduling their first visit.
Ah, okay. So old systems might have kept those apart.
Yeah, totally, which could lead to different records, having to enter things twice, or maybe inconsistent information between the registration side and the scheduling side.
I could see how that would cause problems.
Big problems. So ECW's approach, this consolidated workflow, it ensures that right from the first call or click, the patient's demographic details and their appointment slot are captured together in one go.
So it nips those data discrepancies in the bud.
Pretty much. It helps prevent those issues that cause billing problems or, communication mix-ups later. It's about establishing, a single source of truth from minute one.
So it's not just about being faster then. It's more about building a solid, reliable patient record from the get-go.
Precisely. Yeah, speed is nice, but the real win here is reducing the administrative load by catching errors early. Minimizing those manual entry mistakes, making sure all the necessary info is captured accurately. It sets up clean data for everything else, clinical notes, insurance claims, you name it. It's actually a strategic way to kind of hardwire data quality right into the intake.
Okay, that makes a lot of sense. So let's put ourselves in the shoes of the front office staff for a sec. A new patient calls, needs that first appointment. How do they actually start this in ECW? What's step one?
Right, so it usually starts in the resource schedule. Think of that as the main calendar showing provider availability.
Okay.
The staff member just finds an open slot for the right provider and double-clicks it.
It's simple enough.
And that action immediately pops open the appointment window. Now, that might sound basic, but this is where you really see ECW's integrated design thinking.
And this is different from some older systems, maybe, where you'd have to go to a separate registered patient area first.
Exactly right. You're not navigating away. The absolute key step, the differentiator, is selecting the new patient checkbox right there in the appointment window.
Okay.
It's not just a shortcut. Clicking that box kicks off the registration process while you're still scheduling the appointment.
Yeah.
It's a deliberate merging of those tasks. Very efficient. It reflects that ECW philosophy. Get the foundational record built now while you're booking the visit.
Okay. Clicked new patient. What's the bare minimum info ECW needs to get that record started, and why those specific pieces?
So you start with the real core stuff. Last name, first name, date of birth, gender. You'll see some fields have a red asterisk.
Standard required field marker.
Right. But in ECW, it really means this is critical for baseline data quality, for compliance. You have to fill those to move forward.
Got it.
Then contact info address, main phone number, email. Getting this right is so important. It's not just for sending appointment reminders, though that's huge.
Right. Critical communication.
Yeah, it's for secure messages through the patient portal, maybe urgent follow-ups on lab results. Imagine missing a critical message because of a typo entered way back here.
Oof, yeah. Don't want that. So ECW is kind of building in safeguards right from the start. What comes after the basic demographics and contact details? Linking them to the care team.
Exactly. That's where assigning providers comes in. First, the primary care provider, the PCP.
Oh,
Assigning a PCP is key for continuity of care. And often this field actually fills itself in based on whose schedule you clicked on originally.
convenient.
It is. But then there's the rendering provider field. This one's a bit more nuanced, but really important for billing.
Rendering provider, what's the difference?
So if the patient is actually seeing someone other than their assigned PCP for the specific visit, maybe a specialist in the same practice or another doctor covering,
Oh, okay.
you must update the rendering provider field to reflect who is actually delivering the service for that appointment. Insurance companies need to know exactly who provided the care for credentialing, for payment. A mismatch here. That's a classic reason for a claim denial.
Wow, okay. So it's not just internal bookkeeping, it directly impacts getting paid. What other key details get gathered here that really matter later?
Insurance information is a big one. If the patient has it handy, you enter the policy number, the copay amount right then.
Getting that up front must save a ton of hassle.
Oh, absolutely. It's crucial for smooth billing. Cuts down claim denials massively. Chasing insurance details after the visit is a huge time sink.
I bet.
Then there's guarantor information. For kids or patients where someone else is financially responsible, getting that right avoids major billing headaches.
Right, sends the bill to the right person.
Exactly. And finally, emergency contacts. Really important to get at least one. And if there are specific IPA authorizations or guardianship details, note those too. It's not just nice to have. It's vital for safety and, frankly, legal communication if needed.
But that is a lot of crucial detail right at that first contact.
Yeah.
But I definitely see how it builds a much more complete, compliant picture from the start. So once all that patient info is in, then you define the actual appointment details.
Precisely. Now you focus on the visit itself. You'll choose the appointment type from a drop-down list. Is it a consult, a physical, a follow-up, etc.?
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.